Good evening, everybody, and welcome to our session again. Today is 23rd of April 2021. Another day that we are very, very happy to be here, another evening, another Friday evening, and we are happy. Now, I want to introduce us. We both come from what is called She Chooses to Live Initiative. It's a platform that wants to give people knowledge about things health and mainly reproductive health. So we are here with my tech guy, the usual one, Marion Wakahe, to my left. To me on the screen, she seems to my right, but anyway, to my left is Marion Wakahe. She's really a good tech. She puts me on and keeps me there. And if I feel lazy, she pushes me to come and talk. Anyway, I'm called Jane Wakahe, Dr. Jane Wakahe. I'm an obstetrician gynecologist. Worked for very, very many years as a gynecologist, and then later decided that I didn't know Wajiko enough. So I went to do public health about 10 years ago. I did public health, and this is basically more about public health, what we are doing now, than even about gynecology, but combined together. But the fact that to give public knowledge, that's what it's all about. So here we go. We've been giving several topics, some of them from your choices. You send me requests, then we talk about them. Some from what many people ask me in the office, and I realize there are things that people need to be told about. So it's a combination of what you ask and what that my patients ask in the clinic. So we like to tackle those topics. I keep saying from the onset that I seem to be addressing Princess Diana's, which is yourselves, because you're able to get internet and you're able to listen to us, and I have no problem talking to Princess Diana's, but I keep requesting that anybody who knows how we can get to Wanjiko gets to give us a way forward. When this COVID thing goes a bit down, we shall start going physically to places like Kuruma and such low class, or not low class, such lower economy places, and then we shall be able to talk to Wajiko face to face, and also do some tests for Wajiko, which she has got no access to. So that's what She Chooses to Live wants to do, and we hope that those of you with ability and with knowledge of how we can go around that can join us in helping the She Chooses to Live to do what we feel people need to know. So today we have got another topic that quite a number of people have asked about, and which is a core thing in I was going to say in married life, but in life, because sex happens even outside marriage. So it's a core business which we are going to tackle tonight as much as we can. We'll try to go as far as we can. I'm not sure that we shall be able to finish today, everything today. But if we can't finish today, then we shall continue next Friday and finish next Friday. So what I'm discussing today is painful sexual intercourse. I said from the beginning that I'll call things as they are, because that they are what they are. So there is no hiding about sexual intercourse. So that's what we are talking about today. And a lot of people experience quite a bit of pain when having sex. In medicine, we call it Dyspareunia. It means that there's painful sex it's either during sex itself or a bit after the sexual intercourse has ended. And for it to qualify as painful sex or as dyspareunia, then it has to be either recurrent or persistent, and it has to be there for at least 3 months. If it is there for 3 months, then we call it dyspareunia. We call it painful sexual intercourse, pain during sexual intercourse. If it is a one-off, a 1 day off without continuing, then it's not dyspareunia. Dyspareunia has to be persistent at least three months. Now, who is affected by painful sex? Believe it or not, both men and women are affected. It's only that two things. One, women are able to report it more openly. So about 75% of all sexually active women will have experienced dyspareunia. I'm going to use dyspareunia because keeping on saying painful sexual intercourse is going to take my mouth a long time. So dyspareunia, when I say dyspareunia, I mean painful sexual intercourse. So it's only that many women find it easier to report dyspareunia than men. So 75% of all sexually active women will have had dyspareunia, and that is persistent, painful intercourse for at least 3 months. They'll have had that and they'll report it, 75%. When it comes to men, 1 to 5% report dyspareunia. As to whether this is a true picture or not is very, very hard to tell, because there is a stigma about men reporting pain during intercourse, because it is not expected that men may not be able to perform. So they are not able to report. So we are not sure whether it is a true picture of the real number, 1 to 5% of all men, or whether it is that it is a bit more, but they are not able to report in case they are told they are thought not to be good performers. So the number for men may be a bit higher than that. And what causes dyspareunia? What causes pain? What causes dyspareunia? There are several causes. The first cause is actually psychological. And this is, in a lot of people, psychological dyspareunia is very common. Then there is the people with physical or medical dyspareunia, physical stroke, medical dyspareunia, and there are the people with other causes of dyspareunia. Now let's talk about the psychological causes of dyspareunia. These psychological causes affect both men and women. Like I said, more women will report, but it affects both of them. And they are because of what are the causes that make, what are the reasons that make people get dyspareunia, psychological causes. The last 2 sessions we talked about sexual gender-based violence, and this is one of the commonest reasons psychologically why people get dyspareunia. If somebody has been abused, whether man or woman, in youth or in adulthood, then they are likely to get dyspareunia. In fact, one of the more common sequelae of sexual based violence is dyspareunia. Then the next thing is stress of whatever reason that is somebody is going through, male or female, then they can get dyspareunia. Then there comes fear and guilt or shame. And anybody who is feeling guilty about the sexual intercourse that they're having, they'll actually sometimes experience dyspareunia. Then the next psychological reason is poor self-image. And this is especially in men, also in women. But if a man feels not man enough, then they are likely to experience dyspareunia. So poor self-image is another of the causes, psychological causes of dyspareunia. Then there is also the relationship problems. If somebody is having problems with their partner, then they will, on occasion, experience dyspareunia. Then, believe it or not, this one is the truth, a very, very strict religious upbringing. In fact, I keep telling people that I keep saying that the people who, the couples that I have found that have not consummated their marriage, they come from very, very strict Christian background. And these ones, they come to seek help because 2 months down the line, 3 months down the line, they haven't been able to have sexual intercourse. And even during honeymoon, they were not able to have sexual intercourse. So this strict Christian, not just Christian, religious upbringing can be a very, very big problem. In the I can talk about the Christians because I'm one of them. And what I fear is that we tell girls that it is wrong to have sex. It is wrong, it is wrong, it's wrong. And we keep saying it is wrong, it's wrong, it's wrong. And then finally they get married and suddenly they are supposed to turn 180 degrees and say it is good, it is good, it's good. And this happens to be a hindrance to how they will enjoy their newly married life. And when I dig deeper into these couples and ask them, you went for premarital counseling? Yes. What were you told about sexual intercourse? And they tell me that they were told that will come naturally. It will not come naturally. We need to nurture our girls, whether it's the best couple or whether it's the pastor. We need to nurture our Christian girls to be able to have sex when sex is finally allowed in marriage. So sexual upbringing can be, very strict religious upbringing can be a hindrance to the enjoyment of sexual intercourse. And sexual intercourse was made to be enjoyed, not to be a problem. Now, those are the main psychological reasons why people will experience dyspareunia, both men and women. Then we go to the physical causes of physical and medical causes. And in this case, we shall start with the men. In the men, some of the causes that will be attributed with dyspareunia are what is called phimosis. Now, phimosis is that the foreskin of the penis that covers the tip of the penis is very tight and is very hard to retract. When this is discovered in childhood, they'll even be circumcised in childhood. But some people will go up to adulthood with it, and when it is very, very tight, when it retracts and then tightens the penis, then it can be a very big cause of problem in that case. So phimosis is the one of the causes, and it can be really, really quite troublesome indeed. Fortunately, it has a very, very easy cure, so no big problem there. The other causes in a man that would cause him to have dyspareunia are skin lesions. If, for example, a man had herpes, or a man had warts on his penis, or a man had a skin condition like lichen planus, which is some sort of dryness of the skin, then or some allergies, then a man would experience dyspareunia. There are on occasion, men will get fungal infection. Fungal infection does not usually attack men, but on occasion, they'll get a fungal lesion at the tip of the penis, which is very, very painful. and they'll be unable to perform because they have a lot of dyspareunia. Even at the time of penetration, they will not be able to do it. So the penis would be very sore with that lesion of either is it candida, sometimes is it herpes, those infections. The other cause in a man that causes him to have dyspareunia is what is called prostatitis. Men have a gland called prostate. And if this prostate gets inflamed or infected for whatever reason, then they get a lot of dyspareunia and will be totally unable to perform for quite a while. The other, but a bit rare condition, is testicular cancer. If a man has cancer of the testes, then they are going to find it quite difficult and quite painful to have sexual intercourse. The other reason that men get to have painful sexual intercourse is if they have ejaculation problems. If a man gets aroused and has sexual intercourse, but finally does not ejaculate for whatever reason. There are many reasons why a man may not be able to ejaculate. Some of them are psychological, some of them are physical, some of them are that they are on some sort of medication, sometimes because of alcohol. But for whatever reason, if a man is not able to ejaculate, then there is back pressure towards the testes and they swell out because they didn't release. And then it becomes very painful it becomes painful to have sex any longer. So that's another quite common cause of dyspareunia. There is one that is going to sound interesting, and that is called the fracture of the penis. Believe you me, the penis can fracture like a bone. If a man happens to be erect and the tip of his penis hits a hard, solid surface, then it can break. It can have a fracture. And how will somebody know they have a fracture? It will be one, it will make a cracking sound, just like you break a bone, and then it will start to be very painful. Now, what cracks is not, there is no bone in the penis, but there are very strong muscles that carry blood that made the penis become erect. And those are the ones that kind of tear, they break and tear. And one hears a cracking sound or and becomes very painful. It could be that they were having sexual intercourse and then the man withdraws and somehow lands on something solid, or it could be any other time that his penis is erect and it lands on a solid surface and it breaks. That is one of the most painful somethings that can happen to a man. It makes the penis very swollen, very sore, and it is indeed a very painful process. I dare not laugh about it. It's a very painful process indeed. It is treatable, but what happens is when it fractures, it becomes not only painful, it becomes very swollen because then it makes it bleeds inside itself. So it gets swollen and looks like what is called an eggplant. The shape of the penis now stops being a straight, erect penis and becomes like an eggplant. And if one suspects that fracture of the penis, then they need to very quickly report to hospital. There are ways of treating it, but they need to, anyway, even if I don't tell them, they will report to hospital because it is actually very painful. There is no way they are not going to report to a hospital, and they will be treated accordingly. The other cause of painful sex in a man, physical cause, is something called Byronis disease. Byronis disease is a way that the penis keeps curving. Instead of when it is erect, it is supposed to be very straight and firm. In slightly older men, some, not all of them, in slightly older men, then the penis keeps curving. So it is a curved penis. So instead of trying to penetrate into the vagina with the tip of the penis, then they are going through with a curvature, which becomes a very, very impossible process and becomes a very, very painful process. This is a progressive problem in some men, not all men, in some older men. Usually it is somewhere between age 40 and age 70, but more marked in men who are beyond age 55. Fortunately, there is a way of kind of correcting it, but if not looked after, it keeps getting worse and getting worse, and finally it becomes impossible for a man to erect and make the penis straight. When he erects in a curved way, and it becomes impossible to have sexual intercourse indeed. Those are the usual physical reasons why a man will have dyspareunia. There are other reasons, not psychological, not physical, but like the others is if their partner has a coil, an intrauterine device, and it is either the coil itself is poking out of the cervix or the threads are sharply pointing to the penis. I've seen a man unable to actually have sex for more than a year. They had to have a lot of counseling because you can imagine they went in very happily and then met a very solid coil indeed. And it was very, very hurtful to the urethra. So sometimes women, if your man is complaining that something is hurting him inside there, just go to the doctor and they check whether your coil, if you're wearing a coil, if your coil is well placed and if the threads are hidden nicely so that he doesn't feel them. So the other thing is the other cause of male dyspareunia is allergies. Allergies maybe a woman is, maybe they're using spermicides. Spermicides are medicines that block the movement of sperm and they're used as family planning. Maybe the man becomes allergic to the spermicide. Maybe he is allergic to his own clothes. Maybe there is nobody allergic to the wife, but they can be allergic to clothes or they can be allergic to spermicides. And that would cause dyspareunia indeed. The other cause that would not be would cause dyspareunia is arthritis. Arthritis would cause, because then the bones would be it would be very difficult to move around and have sex peacefully. So arthritis is another one of them. Also, things that will reduce libido, sexual urge. Anything that reduces sexual urge will cause somebody to have dyspareunia. And some of those things are things like diabetes and things like a low thyroid, thyroid that is not functioning at maximum. And also some medications, like some medicines which are given for high blood pressure, some medicines that are given for antihistamines. Some medicines will cause low libido, and then they will cause a man to also experience this dyspareunia indeed. Now, how do you diagnose dyspareunia in a man, and how do you manage it? The mainstay of diagnosis of dyspareunia, whether it is man or woman, is a proper history. Very, very proper history. The proper history will try to elicit, are we talking psychological things here? Are we talking psychological basis? Are we talking physical basis? So I'm very, very very thorough history indeed will be very important. It will elicit whether there is any stress, whether there has ever been sexual abuse in the past. It will try to elicit the relationship between the partner. Is it only one partner that there is dyspareunia, or does he have multiple partners and some are okay and some are not? So it is a history that will tell you much of the things that you need to know. Then there comes the examination of the male genitalia. One will be able to examine the external male genitalia. It would also be sometimes necessary to check at the prostate. And finally, in a man, you also need to take a urethral swab, because a urethral swab checks whether there is an infection in the urethra. The swab is taken to the laboratory and they check whether there is any infection that could actually be the one causing the dyspareunia of the male. Then what is the treatment? I keep saying on this forum, I don't give treatments. I alert people that they have a problem, that problem needs to be taken to the doctor, and their doctors are the ones who manage them. For the man, the better person would be what is called a urologist. You'd be better off seeing a urologist than seeing a gynecologist, because they'll be more able to deal with your problem than the gynecologist. Gynecology, we know a bit of the penis and all, but not to the level of the urologist. So if a man has those issues, the best person they need to see is a urologist. But of course, little things like when it is phimosis, which is causing the problem, then of course, straightforward things like circumcision, those ones. But I usually do not give treatment answers on this forum. If somebody wants treatment answers, then we normally would make a one-on-one, and it's never possible to treat without actually physically examining and taking a proper history. So I will leave it there for the man and decide that if you have any problems, and especially if you have ejaculation problems, you need to go and see your urologist. If you can decide that it's not a psychological thing, that it's a physical thing. And of course, like I said, if you have a penile deformity, then you need to see a urologist. Now, that is it for the man. The woman has a lot. I'm debating whether to start the woman today or whether to start the woman next week, because there is a lot to talk about in a woman's dyspareunia. If I talk today, we shall just go superficial, and you will not get it. So I think let us talk about woman in the next Friday, in the next session. But I would only want to stress again that even for the woman, the main reasons is there will be psychological, just like in the man. The psychological reasons are both male and female. Somebody who has ever been sexually abused, somebody who has a poor self-image, somebody who thinks they are stressed, they are not, they are depressed, they are stressed, such things. Those people will have psychological reasons for dyspareunia. But a woman has more of the physical things than the man. So I believe we leave it there and talk about the female the next time, because female dyspareunia, like I said, 75% of women will have experienced dyspareunia, and they are the I don't want to call them victims, but they are the people who will be expected to live with it. Like I said, a man who has dyspareunia will just shut off and pretend it's not happening. But a woman is expected to have sex whether they have dyspareunia or not. So we shall talk about women's sexual intercourse pain the next time. Meanwhile, I think that's enough talking about the man today. So we shall check if we have any questions. Then we will. I'll get the tech guy to come and talk, to come and check if there are any questions. We've spent quite a bit of time, so I think we will not manage to finish the female today. So we'll do it next weekend. It's something to look forward to. It's a good, it's a good something to look forward to. Any questions? I'm trying to see. Short. Looking short. Yeah, it's a bit shorter than usual. But the man has not got very, very much. Unless they want me to discuss the causes for lack of ejaculation. But that's in another field. Okay. No comments.
No comments.
No questions.
No questions.
Okay.
Nothing.
Anyway, digest that as men and as women. Then next Friday, you can have posted your questions, or we shall answer all the questions. Next Friday will be longer because the woman is a bit more complex than the man where dyspareunia is concerned.
It's looking awkward.
What? Okay. So we say bye-bye.
You said something about the painful, what? What did you say? Why?
What?
Just now you said.
What have I said? I don't know what I've said.
Oh yeah, you said why men don't excuse me, why men don't ejaculate. You can just go through that very fast.
No, it's a big topic. There are psychological causes, there are physical causes, there are medicinal causes. Why men don't ejaculate. But much of it is usually psychological. They have no how shall I put it? They are not at peace with their partner. That's the biggest problem about it. So in the middle of things, they get to lose it. So anyway, some of the physical reasons why a man will not ejaculate is if they have urinary tract infection, if they're diabetic, if they have had some surgery of the prostate, if they have something very interesting called retrograde ejaculation, which means there's a gate that blocks there's a gate that the urine comes through the urethra and the sperms come through the urethra. So there's a gate that opens, there's a valve, a gate that opens to let out urine and closes when somebody is ejaculating so that they don't urinate. So in retrograde, then the sperm goes backwards to the bladder, and you will find that such men will urinate sperm, and sometimes that is a cause of infertility in couples, because then the sperms are going to the urine and they are not being ejaculated when it is that they should go into the woman. The other physical reason is if they have low function of the thyroid. Thyroid is a very interesting gland. It's got a lot to do with fertility and things, even in women. So it's if they are low, then they'll be unable to ejaculate. Then the other thing, of course, is if there is any injury, any trauma to the pelvis, to the nerves of the pelvis, then they will be unable to ejaculate. When it comes to psychological things, then it is that things like depression will make men not ejaculate. Things like, and let me tell you couples, communicate with each other, because the lack of communication between couples or between two people who are sexually active together makes it very impossible to have a good sexual relationship. And then that means that there will be a lack of ejaculation at some point. There will be a sort of cutoff even in the sexual activity. Then, of course, the other thing is, like I keep saying, is the poor body image, the poor image of the man of himself, and the fear that he is going to be judged not to be performing well. In fact, like you women, don't talk to your men about your other boyfriends, because they'll want to compare how was it with the other one as compared to me. And men are, I don't want to say children, but they are very childish in their sexual thinking, and they will want to compare with the other one. So, one of the other ones, especially with the young people now, is the escape from. They have a fantasy about what sex is all about. So when it comes to the real thing, sometimes they are not able to quite perform and finally ejaculate. Then when it comes to medications, then things like some things which are medicines for high blood pressure, some antidepressants, some diuretics that are given to people who are swollen. It's some sort of medicines, antihistamines, they can cause loss of ejaculation, and that loss of ejaculation now makes it very, very painful sexually indeed. I think that is about it.
There are some comments here, but for whatever reason they're not appearing.
They are not appearing.
So I don't know why that is.
Oh, yeah, I can see there, but they are not there. They are not here. We are not being able to see your comments or questions. If we can't answer them today, just ask them the next round. The main thing, I think, what we take home today is men and women, if you are having a relationship, talk to each other, speak to each other, and relax. Sex is supposed to be enjoyed, not to be thought about. We can't see the comments.
No, I don't know why.
Yeah, we are not seeing your comments, so recommend them next Friday. We shall answer them all. Or ask next Friday. Yeah. If tech guy cannot see them, then they are not visible. I promise you. If it was me, I would say I'm not seeing, but if tech guy cannot see, then there is a problem. We shall answer them next week. So finally, thank you and bye-bye. Next week is woman, so tune in next week. Bye. We end video.